When very strict regulations were in place, patients tended to feel safe staying at home and limiting any sort of exposure. Now that some of these regulations have loosened, many patients remain confused or uncertain of really that safety of kind of a quote-unquote returning to usual.
On this episode of Cancer Buzz, part 2 in our series on caring for patients during the COVID-19 transition. Today, patient education for those with chronic lymphocytic leukemia, or CLL. What you need to know is next. Welcome to Cancer Buzz. I'm your host, Summer Johnson. While the initial fears of the COVID-19 virus seem to be receding for most of the U.S., for those who are immunocompromised, including patients with CLL, they are left with uncertainty. Care teams were advised during the pandemic to factor in the risks presented by COVID-19 in treatment planning and shared decision-making with this population, and when appropriate, even to consider delayed treatment. This makes patient education by the cancer care team even more critical now, during this time of transition. Today's guest is Marie Sirek. She's a clinical pharmacy specialist at the Billings Clinic in Montana. Montana was one of the first states to roll back social distancing requirements, so Dr. Sirek has been working to reopen earlier than practitioners in most other states. We asked her to walk us through that patient education for patients with CLL during this transition.
So today what we've seen is definitely a transition back to patients not having as much of that factor for the COVID-19 pandemic as far as treatment decisions. We definitely saw that during kind of the heat of the pandemic, kind of delaying treatment start for CLL, choosing less infusional-based therapies if it was appropriate for the patient. But at this point, our physicians have gone back to treating as usual based on standard treatment guidelines for CLL.
If a patient with CLL required a change in treatment due to those COVID restrictions and now they need a change back, how are you educating them on this transition?
Right. So I think the biggest changes that we saw during the COVID-19 pandemic with treatment was more of a change in how they were followed rather than most of our patients did not actually change off a treatment that was effective for their cancer at that point. So the main changes that we saw were either, like I mentioned, delaying a start in treatment or choosing a less infusional-based treatment if it was appropriate for that patient. And then also those patients that were on therapy already, kind of adjusting the way that they were managed and followed, whether that be more through telehealth follow-up, maybe not coming into the clinic for their visits, even if they had an infusional-based treatment regimen. Maybe the appointment was kind of a telehealth type of visit while they came into their infusion appointment. And really what we've done is just slowly worked those patients back into clinic as appropriate. Some of our patients are still having more of the telehealth visits than they had prior to the COVID-19 pandemic. And I'd anticipate some of that, at least for us, may continue throughout, the ongoing future based on our rural setting.
Well, that brings up an interesting point because you do serve a good population of rural patients. How has the pandemic affected education for those patients?
I think it's very interesting that because of the increased use of telehealth during the pandemic, education for patients in rural settings actually may have been improved. The pandemic almost leveled the playing field for some of that education provided to many rural patients. We really know that in-person education appointments are most effective and result in the best education or attention. Unfortunately, it's not always possible or feasible for highly rural patients to come in for each one of those educational appointments, especially if it's an education appointment with a pharmacist and they would have to drive, 4 hours to come do that education. During the pandemic, educational appointments were something that were transitioned out of clinic in most cases to limit the visits to that healthcare facility, even if it was someone that lived in the same town as our healthcare facility. So the use of the telehealth technology, including video visits specifically, allowed for improved education from a rural setting. The other benefits of this included seeing that patient in their home and discussing how taking the medication may fit into their daily lives actually in that home setting. The other piece was that it allowed patients to include their support systems during those education visits, when if the patient was in clinic, especially during the pandemic, the number of visitors was significantly limited. Although, this is not to say that the use of this technology didn't take some preparation, but that's a whole other discussion of its own.
It is, isn't it? We've devoted a lot of shows to this as well, particularly for patients with CLL. Do any specific topic areas stick out to you where they have concerns or where they are needing more education?
I think patients' educational needs, especially our CLL patients, really vary based on where they're at with their disease journey. I think overarchingly, the educational areas patients seem to lack is the understanding, really the anticipated length of treatment and anticipation of what life might look like on treatment for CLL. Patients that have been on the kind of watch and wait pathway for some time tend to understand the transition to treatment better than those who require treatment right away. They've really had time to process this and know that treatment is likely in their future. But what I find is that patients who aren't in that boat, when they do come to me for education after meeting with their physician, that's kind of the area that's lacking. They tend to not understand that they're going to be on this treatment kind of for a long-term basis, kind of almost like a maintenance type of medication to manage their CLL.
That's a great point. There's a lot that you're discussing with patients, the treatment options, molecular testing, treatment planning, and the changes in the treatment plan that we were just discussing, and the various labs and on and on. How do you check patient comprehension when you're educating these patients with CLL?
That's a great question. This may sound like common knowledge, but sometimes as a healthcare professionals, we tend to forget some of these common knowledge health literacy pearls. Checking for patient understanding of educational materials is critical in the success and adherence to therapy. And some patient factors to non-adherence can include their emotional state, which is especially important in these patients, health beliefs, social support system, socioeconomic status, feelings about their disease and its prognosis, and also that financial toxicity. So in my opinion, and from experience providing education to patients starting treatment for CLL, ideally these patients would meet with their oncologist to review disease state, prognosis, molecular testing, disease monitoring, and really that expected treatment course, which may or may not include a watch and wait portion. And prior to starting therapy, patients would really benefit from having a follow-up appointment, specifically regarding treatment regimen details, especially if a multi-drug or more complicated regimen is being used. This educational appointment or this second appointment would best be served at a different day, a separate day from the first visit. And in many cases, it can be accomplished by support staff such as pharmacists, nurses, or advanced practice providers. This really helps allow that patient to process the initial information, formulate questions, and better understand their disease state as a whole. It's been shown that patients retain less than half of information their doctors tell them during an appointment after receiving, quote unquote, bad news. So it's really important that we give them time to process that before giving them a lot of additional information.
What are some tactics that we can employ to help a patient better retain what we're telling them?
There are many things that we can do during patient education to ensure understanding. And things like this include using that teach-back method, providing adequate amount of time for the educational set itself, which often is a lot more time than you'd anticipate, really allowing that patient to sit with the information, process it, ask their questions. In regards to questions, allowing that patient to ask their questions or bring up their concerns at the beginning of the visit. Otherwise, they may be sitting kind of perseverating on them during the whole education appointment, making sure they don't forget to ask them. Including family members or support systems is important. Assessing their health literacy is important. Providing those educational materials before verbally providing education and using those as a guide and reference throughout the teaching. Because otherwise those patients are trying to frantically jot everything down or try to take it in that you're kind of verbally telling them. Whereas if they see that it's in front of them and they can reference this, it helps them kind of process it a little bit better. And educating patients in their own language is really important. And really the last big piece of this puzzle is talking with your patients and not at them. Learn how it might fit into their life, what they like to do, their fears about treatment. All of that will really make their educational appointment really beneficial.
How does the Billings Center treat care coordination when it comes to patient education? Is that done in the EHR?
In our healthcare system, we do use the EHR for communication regarding care. A lot of these patients start out with a nurse navigator when they're first diagnosed. That nurse navigator helps them kind of navigate the system and learn what it will be like to be in the healthcare system for their CLL. When it comes to starting treatment for their CLL, a lot of that occurs between our integrated specialty pharmacy and the clinic staff. So our integrated specialty pharmacy is working very diligently on ensuring affordable medication for that patient and really setting up kind of the timing for education and initiation of treatment so that the provider is aware of kind of when that start happens so that we can all follow up appropriately when that patient finally gets to start.
Once these patients are taking their medications at home, are there any strategies or tools that you've found that work really well for helping them and their caregivers manage their oral meds?
I think that's a great question. There are many examples of how, technology and non-technologic methods can help patients manage adherence and also symptoms from therapy. Really, quite simply, I think, even asking that patient to have a notebook or, record questions, side effects, and concerns can be helpful. It seems like a very simple thing, but a lot of times patients don't think to write those things down, and then they can't recall when they happened or exactly how it happened. So that's a very simple way to just start. Using treatment calendars for multi-drug regimens can be especially helpful for both patients and the healthcare providers to ensure adherence and treatment understanding. And for those patients that are more kind of technologically savvy, there are many applications and online programs available to help track symptoms. A couple examples of these might be like ChemoWave or CareVive, things like that. What we found especially important for these patients is close follow-up after they start therapy. Our healthcare center has a pharmacist integrated program for oral chemotherapy management, where these patients are getting close follow-up after they start their oral oncolytic so that they feel supported and any questions or concerns that occur after starting therapy are addressed. It also helps build that relationship so that when questions and concerns do come up later down the road, they know who to contact and how they can report those concerns.
Dr. Sirek, have you seen any increase during the pandemic with patients struggling to adhere to their treatments?
I think the biggest thing with medication adherence is that patient understanding of why it's important to have adherence, while allowing someone to follow up with them to check in and kind of provide that support and almost providing a bit of reliability that someone's going to check in on you and make sure you're doing as you've said you did. I don't think necessarily patients were not less adherent during the COVID-19 pandemic, as long as they understood how we were monitoring for the risks associated with being on something like that during the pandemic. I think that's the times when we've identified any sorts of non-adherence would be if patients didn't understand or they were really concerned about being on a treatment like that during the pandemic.
Tribal nations, of course, have been hit particularly hard during the pandemic. And I know that where you're situated in the city of Billings, it's somewhat adjacent to two tribal nations. How has the pandemic affected access to care for them? And then, of course, how has education for these patients changed?
So access to care and education for individuals from those tribal territories during COVID-19 was really dependent on the Indian reservation-specific regulations. In my experience, there were times during the pandemic when patients were unable to leave their reservation based on those regulations. So this, of course, became a significant factor when treatment choices were considered, and any of those educational appointments did, require to be or need to be virtual or on the phone or some sort of telehealth model.
You mentioned that one of the things that came out of the pandemic that surprised you that was a benefit was that you were able to implement telehealth, especially for your rural population. When it comes to treating and educating patients with CLL, what happened during the pandemic that could change the way we treat these patients for good?
I think some of those main improvements that I've seen, one, like you said, was kind of just the creativity and access to that patient education on those platforms. The other big thing that I've noticed is that, really in that setting of uncertainty regarding many pandemic-related CLL questions, really kind of seen an improvement in that provider-patient open and honest discussion of kind of like the gray areas. And I think that's a really nice thing to see because we, of course, should be having those tough conversations in that really open, honest platform.
Finally, was there anything else that surprised you about patient education and the way it's had to change during the pandemic?
I think one thing that's been surprising to me that I'm seeing with patients and really difficulties they're having just as much, if not more, when navigating this kind of new normal as the COVID-19 regulations have loosened, is when very strict regulations were in place, patients tended to feel safe staying at home and limiting any sort of exposure. Now that some of these regulations have loosened, many patients remain confused or uncertain of really that safety of kind of a quote unquote returning to usual. It's kind of a whole new world of uncertainties for many of these CLL patients. I think we have to be understanding of that when we're meeting with them and helping them through this time of uncertainty.
There's even more information related to today's show down in the show notes. Thank you for supporting Cancer Buzz. If you like the information you've been hearing on this Cancer Buzz audio podcast, you may want to check out the Cancer Buzz TV video channel. That content goes deeper into topics for the cancer care professional. You can find that on ACCC's website or just by searching Apple Podcasts for Cancer Buzz TV. Until then, for the entire Cancer Buzz team, I'm Summer Johnson.
Cancer Buzz is a resource of the Association of Community Cancer Centers.